Catherine, always good to have you. Thank you again for your time. Unfortunately, we have hit some very grim milestones in Australia in the last 24 hours, 77 deaths, an unprecedented code brown in Victoria's hospital system. How much worse is this going to get?
Well, the indications on the infections, so the start of this process of understanding what's happening with that infection number in the community, is looking promising. You know, we are seeing a levelling out, particularly in ACT, New South Wales and Victoria, and hopefully in Queensland as well, where if we've reached the peak, we're still seeing high numbers, but obviously, you know, we want to come off that exponential climb which we've seen in previous weeks, and we look like that's happened, and in fact they are really starting to be convincingly levelling out, whichever metrics you look at. Of course, hospitalisations are a concern, and often it's, you know, we look to those community numbers to understand what's going to happen in hospitals. But in fact, we've got a delay on our community numbers. Even with our rapid antigen tests, we've got the majority of them in the previous week, not just yesterday's rapid antigen tests. So in fact, they're probably more in sync, which gives us hope that if we're starting to see that levelling out really establish in our case numbers, that should be mirrored in our hospital numbers in the very near future. And of course, that's critical for deaths. That's where we're going to see the people who can't survive the infection being counted, and that does have another extra delay of a couple of weeks.
Given how difficult it is for so many people still to get rapid antigen tests, how much can we actually trust those infection numbers though? How representative are they really?
We've seen right throughout this wave, with these incredible high numbers, a glimpse of what's happening in the community. Some people are testing regularly, some people have a supply of rapid antigen tests they can use now, others don't. So we know it's not a complete capture of all cases, and we also know that the people that choose to test, let alone report the result on rapid antigen, are a skewed view of what's happening in the community as well. But if we're looking at the overall picture, the Health Department in New South Wales was reporting yesterday, they look at things like absenteeism from work, for example, and all the metrics they look at along with the testing are telling a similar picture. The problem really is with the hospitals that we've also, while we've still got high numbers and high exposure in the community, we're losing staff, as we know, both through social and home exposures as well as work. But also we do have this unknown proportion of those hospital cases who are representing that high rate in the community, because whatever they go to hospital with, if they have the virus as well, they've got to be managed differently. So we're looking at a different story when it comes to case numbers and hospitalisations than any previous wave. Even counting in those rapid antigen tests, it's really hard to have a very firm picture. So we're not talking about ref numbers and so on in the way we have before, because it's too much else driving those numbers. But it's still across all sectors, across all LGAs. When you drill down on the PCR numbers, hopefully we are seeing, you know, enough indicators across all of those to say this has not only slowed, that we're looking at a plateau in those places where the outbreaks really started, particularly in New South Wales.
I'm just keen to get your perspective on two important comments from politicians over the last 24 hours. So we'll just go through them quickly because there's a lot to get through. Firstly, Josh Frydenberg yesterday hinted that the government might be considering cutting isolation time down to 5 days for people who have COVID. He said he noted that other countries have cut it to 5 days. Is that a good idea?
Well, the US certainly have done that, and of course we know UK is talking about possibly not having it. The thing is that by the time most people realise that they have the infection, and it tends to be a shorter infection with Omicron, particularly if you're vaccinated, it might mean that 5 days is actually more than adequate. And that's going to cover most people for their infectious period, and the ones that aren't will have a low level of infectiousness. It'd be really good to have some studies done to actually show us when people do stop testing positive on the rat, so that they're less likely to be infectious to back that up. So we might hear more about the data in Australia if that decision comes in. Low risk though, it will not be day 5 of infection, it'll be day 5 since test, and for most people that's day 10 or more.
Okay, well, speaking of rapid antigen tests, New South Wales and Victoria are recommending 2 rapid antigen tests for students and teachers when they go back to school as sort of a sentinel testing. How much protection would that give? How much help would that be at stopping spread of COVID in schools?
Well, the idea of that is that it's just puts your fingers out on the school community in an active way. You're not waiting for someone to have symptoms or know you've had an infection in a classroom. So that's really the forecasting. If you're going to have a problem, it's that early warning. So it is sensible to do that. Every test isn't perfect. You might get the odd false positive, so they will assess this. But while your community infection rates are high, it's definitely worth doing. But they'll also follow up any positive case in classroom and then test to stay, to make sure that kids can keep coming to school, but to monitor them more closely if they know they've had an exposure in school.
Okay, and of course we need the rapid antigens to do that, which is the continuing problem at the moment. Catherine Bennett, as always, thanks so much for your expertise.
Thank you.